Sorry. म अलि सुन्नु पाएँ थ्याङ्क यू भाउजू साँच्चै हो हामीहरू धेरै छौँ यहाँ धेरै त्यस्तो कथाहरू दिदीले गर्नुभएको कथाहरू So after this, I request Priya to talk more.
Thank you all for being here. I'm really honored and very grateful to all of you for inviting me into this community. I am starting now my work with Anupama and Prem and Robin, and I can't tell you how excited we are at the Hume Center to have them with us on our side, because this topic and many of the mental health topics in our community are public health epidemic, and mental health stigma in the South Asian community is growing, and we're trying to create awareness and decrease the stigma, and really working hard with the community to let them know that it's okay to come out and be open and talk about it through soccer and through cooking classes, and not just one-on-one counseling, but prevention workshops, presentations. So this is the kind of work we want to do more of. So I'm really excited that Prem and Robin and Anupama organized this evening today. I just want to tell you a little bit about the Hume Center. Forgive me, I don't speak Nepalese, my Hindi is a little bit okay. But the Hume Center is a community mental health non-profit. It was established in 1993. We've got 12 programs in the Bay Area, but this South Asian prevention program was a grant that we got from the county 7 years ago to create these kinds of programs specifically for the South Asian population. So very similar to what you were talking about, all our therapists speak a different South Asian language, so we provide services in Nepalese, Bhutanese, Urdu, Hindi, Punjabi, Farsi, Dari, Tamil, Gujarati, Marathi. So our team is very diverse, and we try to represent all the communities in the area. For the past 7 years, we've been providing outreach and education, and this year, through the work with Robin and Prem and Anupama, we want to expand to North County. So we want to provide this service. It's free of charge. Free services for a year. What we are able to do, what the county has given us permission to do, is do one-on-one therapy. We can come into your homes if you can't come to the clinic. We can go into the schools. We can talk to youth in the schools. We really want to do prevention work in the schools because that's where prevention starts, and that's where we can start having these conversations. I know we said this is like a one-day talk program. I want it to be an everyday talk program. We want to talk about it every day. We want to educate the youth about what depression is, what is stress, what are the signs and symptoms of stress and depression, because once you can tell what the signs and symptoms are, you can then help the person get help. So many of us don't even know what we're looking for. You know what's going on in our communities. And what I like about this community is you guys seem very connected and very strong, and you have all these community leaders. So you're interacting with your community every day, and that's what we really need, because it's like multiplication. I'm telling you this information today, and you can go and tell 20 people tomorrow, and they'll tell 20 more people, and we can continue doing our work. So what we do is workshops and presentations. We have outreach at community centers as well. And I think everyone here has spoken about why these services are needed, why we need to seek these services. I want you to think of it as like a medical situation. If you have high blood pressure or a heart problem, you're going to seek out a medical doctor. So why not seek out someone to talk to when you're not feeling well emotionally? It's the same thing, but there's so much stigma in our community that we don't do it. We don't feel like it's okay to do. So there's a mind-body connection. With your mind and your heart is feeling good, your entire physical body will feel good. There's now lots of research out there saying that if you do yoga, walking, soccer, running around regularly, it's going to alleviate depression. So even though depression is a chemical problem in the brain, it's a chemical imbalance, it can be alleviated through physical exercise. And I have a lot of facts and slides about the prevalence of South Asians committing suicide. I think that everyone has gone over the facts. I kind of have the same numbers. One thing we didn't mention is that it is now, today I was reading, it is now the second leading cause of death in youth and teens. Second leading. So we were talking about 10th leading, but with small children, it's the second leading cause of death today. And in the South Asian community, it's even higher. In the South Asian communities, women, the number is increasing. And it's because there's a lot of shame. We respect our elders. We don't want to let our elders down. We don't want to make any mistakes. So when there's a mistake or we're feeling shame, our answer has become suicide. Depression, we've talked a lot about depression. We've talked a lot about stress. And that the pain and suffering of depression is so much that they cannot help but hurt themselves. So how can we open up those conversations and say, it's okay to be depressed, it's okay to be sad, let's try and figure out ways to make you unsad, not so sad. Psychosis is another reason we don't talk about too much. Sometimes people hear voices in their heads. It could be due to schizophrenia or depression, so they really don't have control over it. So it's important to get them medical help and take them to a doctor if that is happening. Substance abuse is a big reason for suicide. So drug abuse, alcohol abuse, in some of the South Asian communities is high. So we see that a lot happening in the Bay Area. And then isolation. We've come to America from all these countries that are very collectivistic. Back home in Pakistan and India and Nepal, we're used to all our communities, we're used to being with our families. And here you come and you're kind of busy in the everyday rut and there's not so much community work, so we're very isolated. And that leads to lower access of treatment. So I really like the idea of what Robin is doing with the soccer and the community strengthening building, because that's what this community needs. I won't go into symptoms of stress and depression. I think we're all very well, educated about what all that is. But good health is one thing you must try and practice. It can really alleviate your stress. Take deep breaths to help your muscles relax when you're feeling stressed out. Because we are caregivers, so we can also start becoming tired. So to keep our stress and depression levels low, we need to practice these things so we can help our community. So, close your eyes and rest for a little while. Think of relaxing things. Always try and exercise or take a walk. Eat the right foods. Try to eat less fat and sugar. Talk to your friend about your troubles. Change the things that are causing you stress. So if you know that this every day the same thing is stressful, try and figure out, problem solve ways that you can make it unstressful. Focus on the good things, try to focus on the positives. It's very hard to do sometimes, but we can all try as best we can. And you're not alone, okay? There's always somebody to talk to. You all have amazing community leaders in your community. We just heard from all of you. Reach out to each other, talk to each other. And I just wanted to throw these numbers out there if you want to take a picture of them. There's a 24-hour support line. It's national, and then there's a Alameda County support line. And then, of course, there's the Hume Center. So we have a site in Oakland, and Prem and Robin can give you more information about that. But our clinician who speaks Nepalese will be at this site twice a week to talk to you if you ever want any support. Or your families, and we're able to come to your homes and your schools as well. All right. So thank you so much again, Prem and Robin. Thank you so much for having me. I'm really honored and grateful.